Hello, I'm Dr. Robert LaLouche, a board-certified OBGYN physician with over 30 years of clinical experience. And today you're going to get your first ultrasound, or it's coming soon. I'm betting you're excited to see the pregnancy, to make sure everything's going okay, and to know your due date. I'm just going to give you some general information. Obviously, I don't know what's happening for you specifically, but this is just some guidelines on what to expect with your ultrasound. First, when you look at the sonogram at this early stage, it's pretty hard to see exactly what's going on. You may or may not see the heartbeat. Your sonographer will generally point that out to you, but a lot of times it just looks like a bunch of snow and doesn't really look like any clear picture that suggests a baby. The sonographer will point things out, but it'll take a little bit of time for your sonographer to identify what's going on first before they point things out, okay? You'll generally come away with a due date. However, the ultrasound has some inaccuracies to it, and so does the first day of your last period. So we take the first day of your last menstrual period, and we take the measurements of the baby depending on how far along. It's called the crown rump length from its bottom to the top of its head. If you're a little further along, they might take other dimensions. Or if you're earlier, they might take the dimensions of the sac that the baby is in, or something called a yolk sac. That is a small little fluid collection, looks like a little bubble near the baby. All of those are used to come up with a due date. You may need to talk to your provider for your ultimate final due date, because an ultrasound has an error margin. The earlier it is, the more accurate it is, unless it's too early. But in general, a first trimester ultrasound, which is what you're going to be getting, has about a week error margin, 7-day error margin, and a second trimester 2 weeks, and a third trimester 3 weeks. Those are estimates. You'll find out your final due date from your provider. Most of the time we give you some clear answers like that when you get the ultrasound, but there is a pretty substantial amount of time where we're not exactly sure what is going on, if your dates are correct, are you too early, what's happening with the pregnancy. And that can be frustrating because you want to know accurate answers of what's going on. So rest assured that while the sonographer is evaluating the pregnancy, he or she will try to give you the best information possible, but the final information you'll need to get from your provider. If there is something of great concern, then your sonographer will get in touch with the provider and get to you as soon as possible, get some answers. So basically there are three scenarios. One is everything looks as expected and we got a clear due date. Another is perhaps you're a little earlier, or we're not quite sure what's going on based on the images, and we might need a follow-up or some lab tests to sort it out. Or the last is there's something very concerning, or the likelihood of a miscarriage, or a miscarriage has already happened. Well, we certainly hope that's not the case. Thankfully, that's not too often. But for all women, the eventual risk of a miscarriage in the first trimester is approximately 1 out of 12 pregnancies. So better than 90% chance everything's going to turn out fine. Why am I telling you these things? Well, you're going to want some clear answers, but sometimes there is an unclear ultrasound. We don't see the pregnancy. We can't clearly see the heartbeat because it's too early. The dates that you gave us don't really match. And to answer what exactly is going on, are things going to proceed okay and the dates are off, or is something serious, a serious problem going on? To put that all together sometimes takes more information than the sonographer is able to tell you, and that can be frustrating. So your sonographer will let you know that there are some things that we're not sure of, and we have to put the whole picture together, and that the sonographer will get in touch with your provider and get that picture for you as soon as possible. But sometimes even with your provider, we can't have instant answers. We need some lab tests or follow-up ultrasounds, and that can be tough and frustrating. Rest assured, we make it a priority to give you accurate answers as soon as possible. So I hope you found this information helpful. I hope everything goes great with your sonogram, and that this is the start of an exciting time for you, and we look forward to seeing you. Thank you.